Welcome to Spotlight. I'm Hale Walker, and my guest today is Dr. Rafia Khalil. Doctor, thank you very much for being with us.
Thank you for having me.
So your specialty as a rheumatologist is probably one of the most complicated for the typical patient to understand, because we have joint pain, and the first thing in conversations for a layperson is say, I've got arthritis. Is that the case, and what should we be looking for?
Yes, rheumatology comes from rheumatism. So that is the age-old arthritis, right? That's where rheumatology, the name, comes from. So I do see patients with joint pain from various causes. People usually call everything arthritis, but not all joint pain is related to arthritis. It could be an autoimmune disease like lupus, vasculitis, and a lot of causes could cause joint pain. So arthritis is just one of the few things that I see, but there's a lot more than that in rheumatology.
And so is that your specialty, or are people coming in with joint pain because I hurt myself on the golf course or playing tennis, and they shouldn't be seeing a rheumatologist?
So generally, most of the pain caused from an injury go to see an orthopedic surgeon.
Okay.
So any joint pain that people don't know why they're having joint pain, I didn't injure myself. I just started having this pain for a few weeks and it's not going away. I've been taking Motrin. What's going on? Do I have arthritis? That's when they come to see me. So patients either come to see me themselves because they have a question, they've heard from somebody that they have seen me for this particular problem. I had joint pain, I saw Dr. Khalil, so they come to me. Or they read on Google that you should see a rheumatologist for the symptoms that you have, and they come to see me. Or most of the time I have referrals from primary cares where they have a certain question. People have abnormal labs like a positive ANA for lupus, or they have rheumatoid factor positive for rheumatoid arthritis, or they have vasculitis, which is multi-system, multiple organs involved. And they have they think it could be a vasculitis, so they sent them to me, primary cares. But of course, a general patient won't know that.
Sure.
So they come to see me when they feel something is wrong. They Google their symptoms and they say, oh, this could be something like lupus or rheumatoid arthritis, and then they come to see me.
Now, you've mentioned lupus a couple times. For our viewers, what is lupus?
It's an autoimmune disease. When I say autoimmune, it means your own immune system is attacking your body. So in lupus, multiple organs are involved. People have joint involvement, skin involvement, kidney involvement, could be lung, could be eyes. So basically, really, any organ in the body can be involved with autoimmune diseases. Specifically with lupus, it's one of the multi-systems, so multiple organs are involved. In cases of rheumatoid arthritis, it's also an autoimmune disease. It affects mainly joints. And there are a lot of other autoimmune diseases that...
Oh, I can imagine.
Yeah.
We're going to take a brief time out, but when we come back, let's talk about the firm, because we're blessed to have the doctors in St. Clair County that we do have, and always looking for more. So let's talk about the company. Stay tuned, we're going to be right back.
Let North Star Bank, one of the most responsive, relationship-based banks in our community, partner with you to meet your financial needs. We have locations all across Michigan, so stop in and visit us today. North Star Bank, guiding the way. Member FDIC.
Welcome back to Spotlight as we continue our conversation with Dr. Rafia Khalil. Doctor, how did I do on your name?
You did well.
Thank you.
Yeah.
So let's talk a little bit about your practice. You are really the only rheumatologist that is working in the entire Thumb Coast. Is that correct?
Correct.
So is it difficult to get doctors in the Thumb Coast covering a myriad of different things? How are we doing in that area?
I would say in terms of specialty, I think there's two of pretty much everything except for rheumatology. There's only one of me. But most specialties, actually GI has only one specialist. It's very hard to recruit specialists in this area. So I might just be the only rheumatologist for quite a while.
So what is the medical profession? As people are coming out of school, what are they looking for? Are they looking for larger cities? Or are they looking for, is it a population problem that we have?
You know, I think people just want a certain kind of life. Being a physician, it's stressful enough, right? So they want more, I think, city life where the kids have multiple activities to do, and more populous. More city is what I think most people want. And they want work-life balance. So they want to go to larger groups where they have less call, they have less work per person, and so they can spend time with family. When you're just one or two, it's just between the two of us, it would be to do call. So I think that's a big problem. They want to go where there are more doctors in each group.
So where do you find your patients coming from? I mean, is it truly coming from the entire thumb area?
Correct.
So people are traveling for a while just to see you?
Yes, and I also am a rheumatologist who sees, I think, more insurances than other rheumatologists even in the city. And so a lot of people whose insurances they don't take come to me. I think I see more Medicaid than the people in the city. So I have a lot of people who have Medicaid and they don't offer the services. They come to see me from even the other side of Michigan or in the city.
And again, arthritis can be one of those things that is so frustrating because it arrives at different parts of the body. People are confused by what it is. So I've got to think that you're dealing with some pretty frustrated patients.
Yes. Well, people come from far sometimes, and that's hard because they have to see me sometimes for every few weeks for a while till I get that settled, because we have to start immune therapy, and it's a little complicated seeing what your insurance covers. So we do everything behind the scenes. So basically my practice is, I'm the only rheumatologist, so I have everything in my office to support whatever I treat. So I have an infusion center in the office, so all my biologics and immune medications are infused in the office. And then I have an in-office lab that's done also. I need lab draws to monitor the drugs, so that's done there, and for diagnostics. And then I have an ultrasound machine and ultrasound studies that we do. I have a tech who does x-rays and ultrasound to diagnose inflammation in the joints and to see where you're at. So if I see a rheumatoid arthritis patient before I treat, I do an ultrasound baseline, start treating them, and then check how the joint's doing. So that kind of stuff we do in the office. Everything is in the office. So we have infusions, lab, ultrasound, x-ray, everything in the office.
So if our viewers are having joint pain and they're watching this and now they can go directly to you, what's the best way to go about setting something up to sit
We have a
down with you?
website, Michigan Rheumatology, and we take most insurances. They call 810-985-5000, pretty simple number, 810-985-5000, and ask to schedule an appointment. So either you get a referral from your primary care, but you don't have to. If you think you want to see me, have a discussion, they just call my office. We also have, I have to mention, Kenzo. I have a therapy dog in the office. He's a mini golden doodle, and we've had him since this year. And so a lot of patients are kind of nervous when they come to see the doctor for the first time. The primary care has told them maybe you have lupus, and so they're kind of stressed and nervous. And so I bring my therapy dog in, and everything else is forgotten.
I love it.
So
people are going to call you just to come see the dog. Thank you so much for being with us today and giving us an education on really what this is all about.
Thank you for having me.
And thank you for tuning into Thumb Coast TV. I'm Hale Walker, and this is Spotlight.